I'm a big proponent of medication-assisted recovery. We used to be called medication-assisted treatment. The disease, the physical process of the disease is usually gone within the first week or two. However, there's a post-acute withdrawal syndrome we all know about, which affects emotions and sleep patterns and appetite and sexual libido and mood, especially depression and anxiety, and that can go on for 6 to 12 months. Medically, we can help that. That's what we call medication-assisted treatment. And here at Seven Summit, we use the whole battery, the whole armamentarium of medications, including all the known products like buprenorphine and naltrexone and everything for alcohol. And we've come up with our own particular cocktails to help people. What medication-assisted recovery does is it pauses the addiction behavior while the patient has the time to change his own brain and his own behavior. Treatment paradigm, typically when a patient is going to go through withdrawal, is we do detox here, and then they're in our residential program for a period of time, and then as they're progressing, we step them down slowly. We go into an intensive outpatient program where they stay with us, living in our sober houses. And once that's completed, they go into our outpatient program. And a majority of our patients stay with us. And we have sober living, where they can work and they're basically on their own, but they are accountable by living in our sober houses. The beauty of our sober houses is that we allow medications, and many of the sober houses do not allow medications, particularly buprenorphine, because it's a partial opiate. But we keep control of the medication still while they're in sober living, so there's no real problems with abuse or anything like that. But that's our paradigm, is to keep people here for 6 to 8 months, not in treatment particularly. The other beauty of our program is anybody who has been with us can come back free of charge anytime to sit in a group, to talk to their therapist, to do whatever needs to be done. We also have certified recovery coaches, which the patients are introduced to the first day here. And the recovery coaches are involved mostly with what goes on out there in their lives, with family, with court dates, with medical appointments, with whatever they need to coordinate that and transport them back and forth, and to help them in planning their recovery once they get home. The idea has to become part of our culture that this is a biological disease. It stems from the brain. It's all about neurochemistry and neuroanatomy. This is not a disease of willpower or lack of self-control. This is not a disease of morality. This is a biological disease. This should be considered a cancer, just like any other cancer. And it takes work, because you have to change the brain. And nobody wants to change their brain. You know who you are, you know what you need, you know what you like, and we have to change all that mindset. And so it's a difficult process. It takes time. It takes a lifetime sometimes. What people need to remember is you come to treatment, that's just the beginning. I hope we can inculcate in our patients the fact that it requires work once they get out of here, once they go home, to change their lives and to continue the journey that they're on. And I think we're successful.